Thank you, Madam Speaker, and good morning.
Good morning.
Years ago, I worked as a teacher at a preschool, largely serving children of abuse and neglect. I was what was called a floater, so I got to work with infants up to 5 years old, and it was an eye-opening experience for me about the positive impacts that an environment that helped the children manage their emotions and treat one another with kindness had, and it was an eye-opening experience for me that had a lasting impression. Now, fast forward to this past summer, I was at a grand opening event for a youth crisis center in Everson, rural community in Whatcom County. The center's right on Main Street, and we had over 100 attendees there from throughout Whatcom County, because I think we all understand the need to address mental health with youth in our community. Now, while I support grand openings and more clinics and things that can help folks dealing with crisis, Madam Speaker, I also believe that we need to do more work upstream to prevent trauma and crisis in the first place. And this bill takes a small step in that direction, a step by encouraging school districts to implement more social emotional instruction in their classrooms, and also providing resources to help those districts do that. Data shows us that social emotional skills help increase academic engagement, reduce bullying, and reduce anxiety and depression. These are skills that I think have always been important, Madam Speaker, but are increasingly important for our youth as we come out of the pandemic and as we see the rise in fentanyl use across our state. Now, I heard in committee, Madam Speaker, that this bill doesn't do enough to address this issue. And I've also heard from superintendents in my district and around the state that they've received too many mandates in recent years. And I agree, Madam Speaker, that we need to be doing more on this issue, but I also agree with my superintendents. And that's why this bill takes a gentle touch approach to add another tool in the toolbox for school districts that want to do more of this curriculum, and providing the resources for those districts to do so. Permission to read, Madam Speaker?
Please proceed.
Madam Speaker, I will end with Fred Rogers, Mr. Rogers, speaking before Congress in 1969, and he said, if we can only make it clear that feelings are mentionable and manageable, we will have done a great service for mental health. That was 55 years ago, Madam Speaker, and unfortunately I feel that we have mental health crises more now than ever, and I urge support of this bill.